We've been told that most children are less impacted by the infectious complications of COVID-19. But a year into this pandemic, pediatricians have real concerns about how the pandemic has affected children in other significant ways. Here to discuss these top concerns is Sanford pediatrician Dr. Stephanie Hansen. Welcome back to the show, Doctor.
Thank you.
So first, are children less at risk for getting COVID-19?
Well, we've certainly seen fewer children having severe illness with COVID-19 compared to adults, but they definitely still get sick and they can spread the virus even if their symptoms are mild or even absent. We do know that there are kids who can get severely ill with COVID-19, and rarely they may have a serious complication called MIS-C, or multi-system inflammatory syndrome in children. This is a severe illness that causes very significant symptoms, and we don't know yet what causes that, but we do know it has a relationship to COVID-19.
Okay, so how then has the last year taken a toll, though, on children's health in other ways?
Yeah, there really are some other dramatic effects that have affected children, even here in our own community. We're seeing a tremendous amount of food insecurity amongst families. So hunger is a real issue. In our clinics, we're working to screen for food insecurity to help connect families to resources. We've partnered with the Great Plains Food Bank to be able to even provide food in some situations to families. On the flip side of that, we're also seeing a surge in pediatric obesity, and we think that has to do with a few things. During our lockdown times, shelter in place, and remote learning, our kids were less physically active than they typically had been in the past and more prone to unhealthy snacking. We also have seen the effect of chronic stress on weight gain in kids. So that's something that our pediatricians have definitely noticed in our community. And then I think a very significant effect we've seen is the effect on mental health and behavioral health. We're seeing an increased rate of depression, anxiety, suicidal thinking, and those are things that are deeply concerning to us.
Absolutely. So what about the checkups? Are kids getting in for checkups?
Yeah, having a lack of preventative care is really a concern too. And keeping those regular appointments, coming in for your well child care, I can't stress that enough, how important that is. And we really want families to stay connected to their doctor and to make sure that their kids are getting that routine care. This includes things like seeing the dentist regularly, getting their preventative care there, making sure kids are getting their vaccines. But when you come for a checkup, your pediatrician is doing things like assessing your child's vision and hearing, assessing their mental health, assessing any school or behavioral concerns that you have. So it is really important for kids of all age to have regular medical care.
Okay, absolutely. That makes total sense. I mean, just as we adults are experiencing so much of this, these children are too, and they need to get in there. So, all right, what about parents and what they can do to help their children?
Yeah, thankfully, there are lots of things parents can do to help make sure their kids are staying healthy through the pandemic. This is something that I talk about a lot, but I can't really emphasize enough how important it is for your kids to eat a healthy diet with regular meals and a variety of foods, including fruits and vegetables, making sure they're getting regular exercise. And you may have to get a bit creative with that because our options are limited due to the pandemic. Making sure that kids have a regular sleep routine and healthy sleep habits. If we could tackle those three things, I think that would help with a lot of the issues that kids are having related to the pandemic. In addition to that, check in with your child, ask them about how they're feeling, create that environment of openness where it's okay to talk honestly about your experience. I want to make sure that kids who have lost a family member to COVID-19 be receiving special attention because they may need some additional mental health services to navigate their grief and to cope with that loss.
Yeah.
And then finally, I think it's important for parents to really set the tone and be the leaders of their household. Take care of yourself. Make sure you're getting adequate nutrition, sleep, regular exercise. Be that positive example and role model for your child and try to set that positive tone in your family.
Excellent, excellent suggestions. Thank you so much, Dr. Hansen, for being with us and sharing all this important information.
Thank you for having me.
Coming up on today's show, we continue our conversation on colorectal cancer and one family's mission to raise awareness about this very serious disease. Stay with us.